Hi, everyone. So I'm really excited today to begin our next partnership with Carbon Health, where we bring your questions directly to various physicians so they can answer them to the community. And today I'm really excited to be joined by Dr. Cesar Djavaherian, who is the co-founder and Chief Clinical Innovation Officer at Carbon Health. And today we're going to be discussing polio. And before we jump into what this virus is and how the vaccines work, I want to ask Cesar, this virus has really hit the news recently because of its detection in wastewater surveillance. So could you please just give a brief description on what wastewater surveillance is?
Oh, yeah, well, first of all, thanks for having me on and talking about polio and its recent kind of reemergence. So wastewater surveillance is frankly a fairly new tool that we have in our public health armamentarium, which is the ability to check wastewater, so toilet water and hand washing water. So in cities to see what types of bacteria or viruses are circulating in those communities. Wastewater detection for coronavirus, for example, is quite helpful during the pandemic and provided some kind of hotspots and early detection of, for example, new variants that were circulating. In the case of polio, wastewater testing was a way for public health officials to try to understand which communities, particularly around New York City, we're seeing spikes in poliovirus particles.
Yeah, we had that first case of polio pop up in more than 10 years that was in Rockland County this past summer. And then shortly afterwards, there was this surveillance testing that began picking up multiple positive virus strains, maybe 2 here, 3 there in surrounding counties, as well as Rockland itself. So then it became kind of apparent in the news that this individual who did contract polio, they were not vaccinated and that they had received the polio virus via a vaccine-derived polio virus. So they were infected by an individual who actually had received a live polio vaccine. So would you mind giving a brief explanation on how a live polio virus vaccine actually works?
Yeah, thank you. So this is quite nuanced. And so there are 2 types of polio vaccines. One is the live attenuated vaccine, and attenuated just means that the virus has been weakened so that it doesn't cause full-blown paralytic effects that natural polio virus does. And then there's another type of vaccine that's basically inactivated polio virus, so IPV. And that type of vaccine has basically denatured the virus to the point where it can't do anything. It's just the viral particles, and those particles will cause an immune response. The reason that the oral virus was kind of implicated in reemergence of polio in New York State is that, actually what public health officials did was look at the strain of the virus, and they identified it as one that was used in the oral polio virus, the kind of weakened virus, which is only administered overseas. So since 2000, the U.S. doesn't provide this oral weakened virus, but instead has the type of virus vaccine that cannot. And so the story is that someone who is vaccinated overseas with shedding virus came to the U.S., shed virus as they're wont to do, but they themselves were protected. And they encountered people who were unprotected or unvaccinated, had no type of vaccine in their system. And so the weakened virus was transmitted to someone who's unvaccinated and then actually developed into a full-blown case of polio, because these viruses will actually kind of adapt and change and then continue to replicate. So in communities where vaccination rates are low, and there are much higher risk for members developing polio, particularly if they have individuals from outside the country coming in who are shedding virus particles. So it's a long-winded kind of explanation for what happened in New York, but I think it's important to distinguish. The oral virus was used really to eradicate polio across the world. So it's a fantastic tool for eradication because it's so easy to administer. The downside of that oral virus vaccine is that there's a very small rate of people who can become infected by it if they're unvaccinated. So if you have groups of folks who are unvaccinated, they're at risk.
Yeah, I think that that's a great point about the advantage of why do we have more than one vaccine. I think a lot of people say, oh, well, why do we have these different routes of administration if we know one works? But, in areas where maybe there isn't the same amount of infrastructure that we have in the US, having something that can just be given orally. And those who were in the US prior to 2000 might remember that that vaccine was given on like a sugar cube sometimes. So like a lot of people joke about like, oh, a sugar cube vaccine. And yeah, that's the one, that's the polio vaccine. But having those different options are super important. And, a lot of people were wondering, so this particular case that happened in Rockland County was in an unvaccinated individual. So if somebody is vaccinated against polio, what are the risks that that person might have currently right now? We only have one case that's popped up in New York at the current moment. And we do have some increase in that wastewater testing, but what about the remainder of the population? Are they really in a heightened state right now, or they can kind of relax a little bit?
Yeah, so the short answer is if you've been vaccinated and you're immunocompetent, meaning your immune system is fully functional, you actually have very little, if anything, to worry about when it comes to polio. And most Americans fall into that category of being fully vaccinated and therefore not really at risk for contracting polio.
Yeah, I agree with that. And something I always like to try to remind people too is that, if you weren't vaccinated when you were younger, it's not a vaccine that can only be given to children. You can get this as an adult too. So that's, a good thing. I think a lot of people relate polio vaccination to childhood. Like you mentioned, a lot of Americans already have had it, but in that, small instance that you have not, it's not too late. You can still go and get that protection. And, that's really important to do.
Oh, what a great point. So just highlighting the fact that, in incompletely vaccinated or unvaccinated folks, this is your opportunity to go out and actually complete your vaccination process. It's fairly easy. It can be done in, ideally in 8 weeks. But frankly, it can be done in less than that time and in extreme circumstances. So.
And then some individuals in the community were also asking if they received their vaccine as a child and now, maybe it's been a couple decades, are they still protected? And if they are not, how many boosters can they get if necessary?
Yeah, so boosters are, first of all, for folks who've been fully vaccinated, again, the risk of becoming infected by poliovirus is incredibly low. The CDC does recommend that even in folks who've had the 3-dose IPV inactivated polio vaccine, even if they've had that, but they are going to parts of the world where polio is endemic, and that's parts of sub-Saharan Africa, South Asia, Afghanistan, that they can obtain a booster dose. And this also pertains to healthcare workers who might be handling poliovirus, at work. So those would be the categories for getting a booster dose of inactivated polio vaccine. But for the general population, I would say this is wouldn't pertain to them.
Yeah, I agree with that too, because we don't see it spreading like out of control or as any type of outbreak right now. It's really, localized in a certain area and to a particular community. And, we'll hopefully know if it begins to spread outside of there, what type of mitigation measures we can start taking to put into place. But I think that, then that leads into another great subset of questions that were submitted kind of related to if somebody did happen to get polio. And a lot of times polio cases are asymptomatic, but if they're not, what are maybe some symptoms that somebody might experience related to a polio infection?
So you're totally right. And frankly, I don't think I realized that, upwards of 70% of individuals who are infected with polio can be symptom-free. And then for the remainder, symptoms can be anything like flu-like symptoms, so fever, headache. In a smaller portion of individuals, you might get meningitis, so infection around the brain. And then in an even smaller portion, you'll get the full-blown virus-associated paralysis. So you can have neuromuscular system grades to the point where you lose function of certain muscle groups. And back in the day, some of those people ended up being in iron lungs, where they were essentially the precursor to our ventilator. Their respiratory muscles weren't functioning any longer. And you might actually encounter folks in their 70s who maybe have a limp, and that limp could be associated with the polio infection. It's because that, and generally their muscles are smaller, so they're weaker. They may not have full control, full range of motion in those extremities that are affected. So big variety of clinical outcomes from polio infection.
Yeah, and it's really interesting because we just finished talking about long COVID in our previous Carbon Health partnership. And it's interesting, as I was looking up more information about polio, is that individuals can still suffer from polio even 10 to 40 years down the road. I think it's something called post-polio syndrome. So it's really something serious to keep in mind, whereas maybe you didn't have any type of this, muscle paralysis when you currently had a polio infection, but that doesn't mean down the line that there might not be some further complications, which is, pretty scary and something for sure we want to avoid. And one way we can do that is through vaccination.
Yeah, it seems like so many roads lead back to vaccine.
Yes. Yep. And I think that that's, something that individuals were curious about too in the community. And this is totally, into what your opinion on vaccination and immunization programs, but they were kind of wondering, like, if we begin to see some of these other vaccine preventable diseases popping back up, is there any type of strategies that we can start to implement, maybe at like a public health level, to encourage people to be vaccinated from these conditions, as we don't want to see them, come back up when theoretically they've almost been eradicated in the US?
Such a great point. And to be frank, I think unfortunately the COVID, pandemic really ended up building some of the muscle, some of the infrastructure that's needed to now hopefully eradicate any additional infectious diseases that come up where vaccines would be useful. So, currently it seems like the federal government is leaning heavily on pharmacies and more so on clinics like Carbon Health, but as a distribution channel to get vaccines into bodies as soon as possible. Particularly because vaccines are so safe, so effective. Very few people have bad side effects from the vaccines, and you may know an individual who's had a reaction, but on a population level, those are still very low numbers, not taking away from any individual's experience. So I think that infrastructure now exists. The question is whether we have the proper surveillance, like wastewater testing, if we've funded public health officials enough to be able to kind of monitor for new up and coming infectious diseases. And I would say that it's interesting to see that the breadth of issues that public health officials are dealing with is somewhat underestimated, I think, by the general public. So there are cases of drug-resistant chlamydia, for example, that might come up in the community, or syphilis is spreading. These are really devastating infections and diseases. And public health officials are actually just as responsible for those as they are for these types of polio outbreaks and things. So if you see a public health official, definitely thank them for the work that they're doing. And if you see government officials who control their budgets, ask them for more money to help them do their jobs better. So
there's been so much talk about, sometimes especially related to COVID vaccines, about maybe they move too quickly. And I think it's really important for public health to also educate the community on these vaccines, and any drug for that matter goes through very rigorous process in terms of every ingredient is tested, every single device that it's interacted with gets tested. I mean, these are very extensive and usually quite lengthy processes that a drug needs to go through. And, you know, the safety of them is at the utmost of the concern of these committees. So, you know, getting that message out there is super critical. I completely agree, because, you know, stomping out some of the misinformation is super important, so we can really highlight what a fantastic, you know, program we have in terms of being able to vaccinate and prevent a lot of different conditions.
Thank you for saying that. And I think, you know, in clinical medicine, if you talking to a colleague who's maybe 25 years older than I was, and he was talking about in his early days, before we had Haemophilus influenza vaccines, and children would be brought into the emergency department with a sore throat and fever, similar to children might come in and have strep, or they might have influenza, or, you know, some of the other common viruses that cause those same symptoms. In his practice, he noted that, you know, you would send a kiddo home, and the next day they were dead, because it turns out that they had a Haemophilus infection and not just your bread and butter pharyngitis. And so he kind of grew up in an era where vaccines were really saved many lives, and he could palpably see the difference. I've never seen a case of Haemophilus in the emergency department in my entire 14-year career. And I think, like, when we think of the new vaccine, so HPV is a vaccine that was developed to prevent HPV, and that virus has been implicated in multiple types of cancers, from throat cancer to cervical cancer. And so if you know people who've been affected by those types of cancers, the number of cases of those will diminish dramatically over time because of these life-saving vaccines. So we should think of vaccines as these really miracle drugs. And I haven't seen any or read about any or studied any where we thought, oh, I wish we didn't have that vaccine. Yeah. You know, not once have I come across a vaccine where I thought, it was better if the world didn't have that vaccine. We really wanted that virus or bacteria to exist more. And so...
No, that's a fantastic point, and it's completely true. And it's great because they're always innovating the vaccines too, is that, especially like if we think of something like flu or even COVID, where people need to get multiple shots of this, there's constantly research that's ongoing on how can we improve the efficacy of the vaccine, or how can we change up how it's administered. Yeah. Kind of like what we started this conversation talking about polio. We have one way it can be injected and one way it can be given orally, because we know that in certain areas we need to have multiple options. And that's still ongoing to this day for even vaccines that are FDA approved and are administered here, but trying to, you know, always get to that next level. How can we always improve? Which is something really cool, I think, about science and medicine, is that we're always looking to the future.
Yeah, such a great point. That's why it's such a good industry, where you can dream of a better way of doing things.
So I think that this was a great discussion with Cesar about the polio vaccine, and I'm super excited that we'll continue the discussion about vaccines in our next segment, but we're going to transition over to influenza, or the flu. So stay tuned for that next discussion. But in the meantime, Cesar, where can the audience find you in case they want to look up more information, not only about what you're doing as a clinical innovation officer, but also about Carbon Health?
Oh, yeah, absolutely. So on Twitter, I'm at Cesar Java, and on LinkedIn, it's just Cesar Djavaherian. Oh, for sure. So the easiest way is if you go to carbonhealth.com. And you know, we provide urgent care and great primary care services. And I think this discussion around vaccines just underlies the importance of having good primary care available to you to make sure that you stay healthy. So it's our whole goal.
Yes, for sure. Especially as we head into these winter months, ensure everyone begins to, you know, stay healthy, stay up to date on your records, and we will continue our discussion about the flu soon, which I'm sure a lot of people are interested in as we head into those colder months. So until then, we will chat with everyone soon. So thanks again, Cesar. Talk with everyone.
Thank you.
Yep. Bye.
Thanks. Bye-bye.